Well, hopefully here you can see where we've transferred the position of the central incisors, the midline, and transferred it to the mandibular cast. And also you see I've sectioned out the section of the wax rim for that area. And then the most spectacular, if you want to call it, part is the amount of horizontal overjet that you can see here. So it would seem like we have all kinds of room to set a denture tooth, but the reality of it is that we're going to have zero vertical overjet and obviously some significant horizontal overjet. So to provide space for the positioning of the tooth, because again we'd like to have the tooth, at least the neck of the tooth, positioned over the ridge, not out in the vestibule. This tends to make the denture a bit more stable if you're able to place it on the crest of the ridge. So what I'm going to do is I'm going to reduce some of the record base to provide a little bit more room for setting the denture tooth. The sequence for adjusting for room for a denture is to basically thin out the denture base. As a matter of fact, you can actually just cut through it and put some tin foil underneath it and give yourself some space that way. If that amount of space is still inadequate, then at that point you can start recontouring the neck of the tooth again to shorten the tooth to allow you to position it in the correct space. So we're going to go ahead and do that. I'm going to turn the camera off again, but again I thought you'd like to see from multiple views that what appears to be an extraordinary amount of space and also extraordinary amount of horizontal overjet, though that's not particularly unusual in many denture wearing patients. So we'll go ahead and proceed with setting the mandibular. Well, hopefully you can see in this video how much I've thinned the anterior portion of the record base. Now I haven't perforated it, but it's almost thin enough to read the newspaper through. So hopefully this will provide enough room for setting, again, the neck of the tooth, for the mandibular tooth, as close as possible to the crest of the ridge. And this particular part of the tooth arrangement's a little bit more, how shall we say, time consuming, simply because you have to constantly view the position of this tooth and try to align it so that it's also in the midline. So we're trying to get the neck on the tooth, we're trying to duplicate where the midline is, and of course begin to follow the arch form. So it takes a little bit of manipulation, but the technique remains the same of creating the little wax root and making an initial attempt at seating or placing the tooth on the record base and seeing where you end up. So that's what I'm going to do. Again, this particular step requires having the cast both mounted on the articulator, simply because we have to be able to determine the vertical height. And again, for the occlusal scheme we're using, which is a non-balanced flat occlusal plane, we want zero vertical overjet. And I think hopefully as we move along here that'll become more apparent. But so we'll see what we get here when we initially place the tooth. Again, I gave myself a pretty common problem. I gave myself a reference point. As a matter of fact, I'm going to go ahead and continue on up on the land area to kind of approximate where the midline was that we established previously in the maxillary arch. Again, the positioning of the mandibular central incisor is being guided by the position of the maxillary central incisor. So, as I mentioned before, the whole setup is dependent on that initial positioning of the central incisor. And again, we're just going to kind of lock these teeth into place so that they don't keep moving around on me. I'm not going to make any attempt to start to contour and festoon the record base, but we'll go ahead and see where we are relative to the so midline wise, I'm going to need to move it slightly toward the mesial, and at least from this view it looks like we're not too bad a shape. However, it's when we start to view it in this position, which hopefully you can see, and then from the lingual, which I'm not too sure you can see, but again, this is where we start to have the challenges of positioning the tooth to get its vertical height correct, attempt to get the neck on the crest of the ridge, and to maintain the position of the midline relative to the maxillary central. So instead of wasting a lot of filming time, I'm going to go ahead and position that and show you where I am when I complete that. Well, I've gone ahead and actually set the mandibular, both the mandibular central incisors. It makes it a little bit easier to see what's going on, and I think you can see that we have some significant horizontal overjet, but I'm not going to be concerned about that. And then if you look from this view, I think you can see that the necks of the teeth are at least reasonably close to the crest of the ridge. Perhaps a more important view, or one that more illustrates better what I'm talking about, is when I flip it up. You can see that the necks aren't sitting right along here, which would be the end of the vestibule, but instead the necks are tipped back. Also, if it shows up in this video, I want to tilt this around so that you can see the facial surface of the central incisors is almost perpendicular to the residual ridge. So again, with respect to positioning teeth in a more or less ideal position, this is what we'd like to see. And additionally, if it shows up, perhaps you can see from this view that the central incisors of on the mandibular arch are in line with the central incisors of the maxillary arch. I'm going to go. I'm going ahead and set the lateral incisors and also place the canines. So now hopefully you can see that the canines are in such a position that the distal portion of them are pointing down towards the residual ridge, and this doesn't fall apart. You can see that we can go from the tip of the canine back, and that our occlusal plane will actually be from the tip of the canine back to 1/2 to 2/3 the height of the retromolar pad, as we talked before. So what I'm going to do is go ahead and remove this last segment of the occlusion rim and start setting teeth for the posterior. Now, because we have these landmarks available at the tip of the canine back to 1/2 to 2/3 height of the retromolar pad, then we no longer need to have the cast on the articulator at this point, because we have the landmarks we need. We're going to go and place the central groove down the height of the residual ridge, right down the middle of the center of the residual ridge, and we have landmarks to establish the occlusal plane. So I'll go ahead and start setting those teeth, and then we'll cut back in again.